Hello, everyone. Welcome to the show. My guest today is Gayle Schwee. She's an occupational therapist based in Austin, Texas. She co-founded Matrescence Occupational Therapy. It's a private practice dedicated to empowering mothers through the transformative journey of motherhood. She's also a co-founder of a Maternal Health OT, a community that's designed to support occupational therapy practitioners specializing in maternity help. In 2024, Gayle was selected as a Notley Fellow, joining a diverse group of young leaders committed to making a positive impact in the Austin community. Welcome to the show, Gayle. How you doing today?
Doing great. Thanks for having me. I'm really excited to be here.
Great. So tell us, how did you become an occupational therapist first, and then what inspired you to start your own business?
Yeah, actually, occupational therapy is my second career. I was in pharmaceutical research first, worked my way up there, started off at the very bottom, working in the lab, and then reviewing data and paperwork and managing some projects. And then I realized, it didn't really fit my personality that well. I really loved engaging with people and being creative. I was actually just telling someone the other day when I was working in the lab, I had a really ergonomic setup. And I didn't even realize, I didn't realize I was doing that. I had all my test tubes set up such a way, my pipette set up such a way so that I was, using minimal movement, whereas some of my colleagues were like all over the place. So it's kind of cool to reflect on now. Um, yeah. So then when I realized I didn't feel as fulfilled in that work, um, I did a Google search and I wish I had remembered what the search terms were, but it was something about like coaching slash medical slash creativity, probably, I'm thinking. And then OT came up and I had never heard of it before. So that's when I decided I had to go back and, get a bunch of my prerequisites and apply to OT school. And that's rest is history for getting into OT.
Really cool. That's a really cool story. And so looking back, you're saying now that you actually design your workspace very ergonomically. Uh, that's cool. And then, how many years did it take for you to start your business from graduating from OT school to starting your private practice? And where did you work before you got into private practice?
Yes. So, I worked a handful of jobs before starting my private practice. I started off at a work hardening clinic where I created the program there. Short stint, did a little bit of peds outpatient, but then my actual OT career, I would say, was in adult acute care. So between graduating OT school and starting my own practice, it was 17, 5 years. Um, Yes. And so there was an overlap because I was still PRN in acute care when we started Matrescence here in Austin. So, yeah, in collaboration with a coworker of mine, we decided that, there's got to be something more with what we can offer um, different populations. She was also in acute care with me. And, it's just acute care is great. It's a great place to work. But to me, it felt like there were a lot of limitations. I wanted to see why we weren't treating postpartum, postoperative C-section, why there's no order sets for them, right? I know there's other programming now that there's plenty of hospitals across the country where they have started that. So from where we started Matrescence, we kind of wanted to like bring it back and just look at how can we serve the community first. And so that's how kind of how we got the idea to start.
Okay. That's interesting. Thank you for sharing that. And then, so can you tell us what came first? Was it master's in occupational therapy or maternal health OT?
Matrescence came first.
Oh,
And
I
that
apologize. I said masters, matrescence. Yeah. Matrescence came first. Can you talk about the name a little bit as well? How did the name
yes.
came about?
y- Yes, matrescence is actually the transition into motherhood, much like adolescence is the transition into adulthood. And the term was coined by the same person who came up with the term doula. I can't remember who it is now, but so very in line with the, motherhood space and things like that. Um, so yes, that came first. And we, like I said, we wanted to support prenatal through the first year. And in the process of creating our business, um, we did Google searches to see what other practices are doing this, who else can we connect with, and kind of get an idea of where to start. And at the time in 2022, there weren't many others online. We connected with a handful of others, some on Facebook, and then met with the other co-founders now. So it's myself, Jessica Peterson, Haley Kraszowski, and Libby Skolnick. And they kind of had the idea of starting a community as well. And so we all got together and was like, why don't we do this together? Because first of all, maternal health OT is so new, so emerging, that it doesn't make sense for us to be all competing, right? We want to have a united front in order to make a bigger impact and show that maternal health OT needs a real space in OT. So so we got together to create the network.
Right? Sounds really cool. So, and was that so? There was four co-founders.
Yes,
You
there's
sure?
4. Mhm.
Got it. Okay. So, and tell me, were you still working full time when you started your private practice, or was that a side gig in the beginning?
Yes. So I was working PRN when we started Matrescence. And then uh, having a child. So that's the other thing that got me into this is I had had a baby during COVID. So I was in acute care, fully pregnant, and then, trying to figure out that transition for myself. So among that is where Matrescence came about. And then maybe a year or so after that was when we co-founded the Maternal Health OT Network with the other co-founders.
Got it. Understood. Thank you for clarifying that. So, can you take me through the first 6 months of your business? How did you get the first five clients through the door? What were some hurdles on the way there? Did you have any regrets in the beginning?
Yeah. So, wow, the first 6 months, it's funny to reflect on that because at the time it felt like you're so excited. We just wanted to network with people. We we connected with a bunch of the birthing community here in Austin. I think it's a great place for us to have started this business because that community is pretty large. Um, and there was a networking event that was with doulas, midwives, a couple OBs, pediatric dentists, pediatric PTs. We were the only OT in the room. So, um, not only for infant health, because, there were some infant providers there, but maternal health, nobody had ever heard of. So, in the first 6 months, we did lots of networking, lots of connecting with people. To get our first paid client, I guess I would say, we had seen a bunch of beta clients at first. So, friends of friends who are expecting. We kind of did what we had envisioned at the time what a typical workflow would look like for us. So for us, it was seeing them in their homes during the third trimester, kind of setting up their space, talk about energy conservation and basic education, and then follow up again at their house once baby was there and kind of review some of that stuff. And so our first paid client came from a referral from one of the beta clients.
Mm, interesting. And then, how long would it take for you to get the next patient if the first one was actually on the care?
Yeah, I would say maybe a couple months. So it's one of the challenges I think with this is one, it's a field like preventative care, right? And I think where the culture is here in the US, it's kind of like, well, moms have been doing this forever. Like, why do they need additional support? And when thinking about mothers themselves, they also don't look for support for themselves, right? So not only would potential referring providers have a hard time figuring out why they need to refer to us, but also the moms wouldn't come to us on their own. So it took a couple months. And then getting connected with more of the other providers, they realized, oh, okay, where we differ from some of the other providers, we bring in that mental health piece. because it looks like a lot of overlap, right? I know when we started talking to some doulas, we kind of got the sense that like, oh, I wonder if they think we're stepping on their toes because we're not, but we're not, you know. But there's a lot of education that happens in both settings. So
Okay. Sounds good. That makes sense. And, for those listeners maybe not familiar with the space, can you talk to us a little bit about the type of services you offer to your clients, and what makes you really different from the competition? Or
yeah. So I would say Matrescence kind of has two avenues. So our first, I guess, first client base are the in-home clients, right? So anywhere from prenatal through the first year. And a lot of it, like I said, is education. We did some postpartum recovery for some clients, depending on how traumatic their birth was. So that looked a lot like acute care, but just in the home. So that was, I mean, um, a pretty good translation for me. I thought it was great, but then we also got to go in the community with that new mom and how is she going to manage the stroller getting out of her car? Um, how is she going to get around the house safely? We recommended a walker at the time. She still had a JP drain when she got home. She got home 8 days after birth because she had had a uterine rupture. So hers was a pretty acute. And no services, right? Like she got no services in the hospital. I don't think home health was ever brought up to her, but her husband reached out to us. So yes, so a lot of work in the clients' homes there. And then more recently, I'm now partnered with a pediatrician's office. And so we are seeing families and newborn families during their well care visits. So that's been very impactful as well. Because now this is where we're like providing all of that preventative education. And we're there in primary care, which is very, very exciting.
so, on that topic, so would partnering with pediatrician's office, is that part of the wellness visit that they actually paying the pediatrician for, and you guys, kind of sharing the revenue, or is that a separate service that the pediatrician offers uh, for the wellness visit?
Yes. So right now, it's a separate service that the pediatrician's office offers. We're still, of course, trying to figure out a way to make it accessible to everyone. It's, this kind of service, a lot of the other maternal health OT practitioners that I've connected with, we're all private pay out of network, right? So we have heard that the reimbursement rates, they're there, but to be able to see mom and baby as a dyad together and work with the family and, have as much flexibility as we do, private pay is the way to go. Um, and then considering for the pediatrician's office, like I said, that's a separate membership for families right now.
Okay. Thank you for clarifying this. So, and then just to confirm now, so you see patients in pediatrician's office, you see some patients in their homes, right? And then some clients come to the office as well. So there's three different places of service.
Oh, actually, no, I don't have a brick and mortar. So we are mobile mainly to the clients' homes and then just at the pediatrician's office. And then at the pediatrician's office, again, it's more general education, preventative. And if they decide they need additional services, the pediatrician sends out a referral list and we're on the referral list and they're welcome to see us in their homes.
Got it. Okay. Makes sense now. Very good. And then do you treat 5 days a week, or you treat certain number of days and then certain number of days you actually running, doing the business management aspect?
Yes. So currently I'm in the clinic 2 days a week. And then I have 1 to 2 days reserved for in-home clients. So right now, like the marketing for bringing on new clients has slowed a little bit in the new year, and I'm completely okay with that. So, so then 1 to 2 days dedicated to behind the scenes business administrative things. Yes.
Very cool. And when you said marketing has slowed down, is it the leads coming from marketing, or you put less effort into marketing this year?
Good question. I have put less effort into marketing so far this first quarter. But I will say, despite that, we've still had a couple discovery calls come in, which is great. People are still able to find us. And then, of course, converting the families is a little bit harder. So, but I do have someone lined up for next week, so it'll be good. Because I have been spending a lot of time on the pediatrician side as well. We're building up like educational modules for their online platform. So there's plenty of work to go around.
Good, good. And then, uh, speaking of marketing, so what marketing efforts have you had? Is it Facebook or Google, or is it door to door, or anything else that maybe people not familiar with you'd like to share?
Yeah. So as far as like if we talk about paid marketing, is that what you're asking
Both.
specifically?
I think listeners will be interested to know in both organic marketing as well as paid marketing. Uh, any type of marketing would like to hear.
Yes, definitely. So, some more of the organic marketing, right? We did a couple lunch and learns with some pediatrician's office. It's I'm sure everyone's heard it's hard to get into physicians' offices, right? So, I was fortunate enough to have the connection with the pediatrician. So that was helpful. But like I said, going to those networking events in the birthing community, there's always another clinic that's opening that wants to host something. So we connect there. As far as some paid marketing, we did try a couple like paid Instagram and Facebook ads when we had a community class, small group class coming up. I would say we didn't get as much out of that as maybe we could have. Um, but we did get a handful of clients just responding in Facebook mom groups. So whenever there were questions, I would reply, this is probably what you could look at. We can do a free consult call. Um, we do community like tabling events. So I just did one recently called the Doula Share. So doulas all over the city came and they had tables, and then they invited other specialty providers to come as well. So yeah, I mean, just getting out there in the community. We used to do some like email blasts and things like that, but I'm really finding that making those connection, right, where the providers actually remember you, you make a relationship. Um, I think it's a better way to look at things than just like networking, right? We're creating and fostering relationships.
Yeah, yeah, makes sense. And then, uh, I like that topic of marketing to physicians, right? Because it's a taboo. A lot of therapists, they say, "Oh, I don't do it because they never send us referrals," and some clinics rely strictly on doctors' referrals, right? From your experience doing that lunching with the pediatrician's office, did you get any referrals from these offices, or that was just a waste of resources and time?
Yes, initially, we were like, this was a waste of time. They didn't even really stop and talk to us. Everybody's like in and out at the clinic. Um, but I think planting that seed or putting the bug in the physician's ear, it was months later when he came back and was like, "Hey, I have an idea." And this is what started the collaboration with the pediatrician's office. So it wasn't immediate. It was not immediate. And I think that's another thing that we had to remember is like the first year we were just planting a whole bunch of seeds. And then after that, stuff would come up and we'd have to decide, are we going to move forward with that or are we going to prune it? Like we got to weed out the things that we don't really want to do.
Yeah, yeah. All right, that's interesting. So that pediatrician's office that you guys partner with, that was your lunching, right? Uh,
Mhm.
after it makes sense. Okay, very good. And then, um, I mean, from my personal experience, right, running and operating clinics, being an OT, so we had I don't know how many years ago, but we had a pelvic floor uh, specialty that we offered. Like we offered pelvic floor therapy to some of our patients. And the hardest thing for us back then was actually educating uh, patients and even more importantly, providers what pelvic floor therapy is, right? Like a lot of doctors, OBGYN doctors even never heard of it, right? A lot of primary care doctors never heard of it, right? Do you find this an issue, like educating providers, and understood they understand what type of services you offer? And if so, how do you address it now?
Yes, definitely. There is definitely a gap in understanding, I would say, when it comes to providers. everybody's so siloed, right? Everybody knows their own expertise. And I would say, except for us as OTs, right? Because we can see, um, we have that lens of seeing where everybody's coming from. So I think being in the pediatrician's office and working so closely with the primary care providers has really given us a sense of what is it that they understand and how much do we need to educate on. Um, there's not enough time, but I will say, like, you just need to find the one, right? You need to find the one that gets you and understands what your vision is, and from there, you start connecting with the others. I don't know if I answered your question.
Yeah, yeah, definitely.
Okay.
Okay, very good. And then my other question for you is balancing patient care, advocacy, and business growth. How do you manage it?
Mm, that is a good question. So I would say what takes the biggest portion right now is advocacy. Because, like you said, it's hard to get the patients in without people understanding what we do. So, things like this, getting on podcasts, presenting at the AOTA conference or state conference. We had done that. Um, the work that we're doing in Maternal Health OT Network, um, that is helping bring more awareness to what we're doing. And then also in the local level, like I said, just continuing to educate. Secondary to the advocacy, I would say you said patient care, and then what was the other?
So patient care, advocacy, and business management.
Oh, yes. Yes. So right now, just where my business is situated, it's the advocacy, the business management, and then the patient care. That's just where I happen to land in this first quarter. But last year, I would say it was advocacy, patient care, and business management, right? Like trying to figure out how to navigate all those things. So it's interesting to just think that there's always a flux, right? Depending on what's the busiest angle you have at the time.
Absolutely. Yeah, Gail, you mentioned that uh, you have uh, you said cash out of network. So does that mean you provide a super bill, or you just say it's accept strictly cash and you don't provide super bill? What's the model currently?
Yes. So we do offer super bills, and we were in close communication with our families and had gotten back that for some of the families, they were able to apply to their deductibles. So that was comforting. There wasn't anybody, I don't think, that actually got reimbursement. Maybe partial. And you know what? I think it was with Apple. They worked with Apple, so
Mhm.
have great insurance, right? So they were reimbursed a portion of it. But otherwise, yes, it's cash private pay.
Got it. Okay. Can we talk a little bit about maternal health OT? How do how do you work on that, and how much time in the case?
Yeah, it's wonderful because there's four of us, right? And the reason we wanted to start this was, again, for connection, but we also didn't want to add a whole bunch of extra work to our plates because each of us have our own separate maternal health OT business type, right? So um, this uh, business is virtual. We created a community where we are providing like mentorship. We do live business calls, live clinical calls. There's a bunch of resources that we're sharing with our members. And then one of the biggest hits, I think, is we bring in guest lecturers. So coming up in, I think, April, we're having Hannah Sluchis come in, and she's actually about to publish the first maternal health OT textbook. So a handful of us had the opportunity to contribute to that textbook, and now she's going to be able to share it with our group. So there's a handful of things that we're doing there, but again, we're trying to make it low stress. So we're spreading the um what is it called? The responsibilities among us. And so we have it to where we alternate monthly, like who's the head person that month. So it'll be a couple months before we feel like the heat or the stress for leading the group again. It's working out pretty well.
Okay. Oh, thank you for sharing that. Well, and then from basing your current efforts, right? Marketing efforts. What would you say is the biggest return on investment? Is it partnerships or is it Facebook groups? How do you get most of your clients currently?
I would definitely say it's, the partnerships, right, and the relationships that we've had, followed by, um followed by Facebook groups. I would say the social media otherwise, like posts and, paid advertisements haven't really benefited us at all. I think it's really just making those meaningful connections with people.
Okay. That makes sense. And then I like to talk about reports a little bit. Are there any reports that you run on a monthly basis for your practice?
Not on a monthly basis. We've been doing annual ones just because, again, we're pretty, like, small. Um, so, yeah, I'm not very official with the reports yet.
Understood. Okay. And then what advice do you have for any therapist that are, looking to start a practice or a business? Maybe some hurdles to avoid or things that you encountered. And if you knew better, you would have avoided them.
Yeah. I love this question because I'm always so passionate in helping others get started. The first thing is, they always talk about doing your, oh, what is it called? Like to assess your population and the need, right? So make sure you have a good idea of what that is, depending on what your business idea is. And then, like I said, connecting with anyone and everyone who is in that field or adjacent to, right? We got really creative in thinking about the providers that we could potentially connect with, like yoga instructors or like, people who are working with our population, but not directly in our way. I would say, let's see, things to avoid or to make sure that you look into carefully is making sure that you have contracts, written up well, like have legal counsel to look over some of those things, right? Because this is your business, this is your reputation and livelihood, so that's really important. Things that I wouldn't do, I don't know that I have anything there. I think everything that has happened in the business has been a learning experience. Um, so I would say if you make what you think is a mistake, like just learn from it and keep going. That that's what's been most helpful is just knowing when to pivot and following where your people are needing you, right? Like meet the needs of your population.
Okay. Thank you for sharing that. Yeah, it was great having you on the show and learning about your practice and about your journey. Okay. And I hope we could touch base in a few years to see where practice is, right? How it has evolved. All the best to you. And I hope to talk to you soon.
Thank you so much for your time.